Hello, my name's Carolina Rodriguez and I'm a speech and language therapist here at the Speech and Language Centre in Hong Kong, where we provide services to support children and adults with speech, language and communication needs or difficulties. Today I'm going to be talking to you about voice care for professional voice users and those who frequently experience loss of voice or other voice problems. When a voice problem is the result of us misusing or abusing our vocal folds, it's important that we reduce or eliminate anything that's causing irritation to the vocal tract and to change the negative vocal behaviours. This advice will fall into two categories: vocal tract hygiene and voice conservation. Vocal tract hygiene involves taking positive measures to maintain a healthy larynx and reducing anything that's causing irritation to the larynx. So it's best to avoid smoking, including cigars, cigarettes, pipes, alcohol, especially spirits such as gin, vodka, whiskey. Now these may feel soothing when you're experiencing a voice problem, but actually what they're doing is anaesthetising the area whilst causing further irritation. So it's best to avoid drinking or drink in moderation when you're experiencing a voice problem. Smoky, dry or dusty atmospheres should be avoided generally in order to maintain good vocal hygiene, but especially when you're experiencing a voice problem. Gargling, indigestion and heartburn, as the acid reflux associated with these conditions causes irritation to the larynx and the vocal tract. Very hot, very cold or very spicy foods. Tea, coffee and fizzy drinks which cause dehydration. And the use of recreational drugs or contact with chemical irritants. It's helpful to drink plenty of water, at least 6 to 8 glasses a day. You know you're drinking enough water when your urine runs clear. Have steam inhalations frequently, but especially if you know you're about to use your voice a lot. Keep the atmosphere moist. This can be achieved by buying plants, such as the one you can see behind me, keeping the windows open, keeping the air conditioning on as little as possible and using a humidifier. Taking aerobic exercise to maintain healthy lung function and making sure that you're getting adequate amounts of sleep each night. Voice conservation. Now the changes in the abused vocal folds, such as thickening, nodules, inflammation, must be allowed to settle and reduce if the voice problem is going to go away and if ideally you're going to stop it from coming back. So it's important that you use your voice as little as possible and with as little effort as possible, even if this means that you're using a quiet and breathy voice. Following points should be remembered. Don't whisper. Use your voice gently and don't shout, especially if you're angry or upset, as this can cause vocal fold strain. Where possible, you should avoid talking against background noise. No singing, no calling from room to room. Keep telephone calls to a minimum. Reduce hard glottal attack, which means the force with which you pronounce your vowels. So instead of saying all the time, which is an example of hard glottal attack, say all the time. That gentle onset is much better for your vocal folds. And also women, be aware that some hormonal changes can cause changes in the voice, so just be aware of this. If your voice starts to deteriorate or hurt, put yourself on vocal rest for 30 minutes to an hour. You should avoid talking more than necessary, but equally you should avoid going on total voice rest, as this can actually cause more harm than help. It's really common when the vocal folds are inflamed for there to be a build-up of mucus, resulting in you needing to clear your throat more frequently. When this occurs, in the first instance, try a firm swallow to clear the mucus build-up. Or if this fails, try a gentle throat clearing so that the vocal folds aren't damaged by vigorous coughing. Most importantly, observe the way you're using your voice. This is most certainly the cause of the problem in the first place, and it's helpful to learn from this and be able to adapt the vocal behaviours. If you're experiencing persistent voice problems, you should contact an otolaryngologist or an ENT specialist and also a speech and language specialist. Thank you for watching.